This is J. Randall Wilkerson, author of the Heart Failure Recovery Plan, Successful Heart Regeneration Using Metabolic Enzymes. This is part 51 in a 58-part video series on every chapter in the book. Please review our introductory video for background information. Part 51 will go into the medical subject, arrhythmias. Basically, arrhythmias are irregular heartbeats, and they have been mentioned several times in this video series because of the great risk factor they impose. 51% of all cases of sudden death where the heart stops for good is caused during an arrhythmia. This is a medical term for irregular or erratic heartbeats of many different kinds, and it's very common with congestive heart failure. Some arrhythmias can cause heart failure if they last for days. A common feeling is heart palpitations or sort of a thumping in the chest, and this often occurs in the ventricular chambers of your heart. You may feel like your heart is doing a flip-flop or fluttering, a pounding of the chest, dizziness. You may even become lightheaded or fainting. An overall feeling of becoming weak, tired, fatigued, sometimes even shortness of breath. You can often stop continuous palpitations by coughing. Another trick is to look at an object in the room like a clock. Just concentrate on nothing else and break the psychological stress figure that's going on in the back of your mind. Atrial fibrillation is a common irregular heart rhythm in the atrial chambers of the heart. The atria are the upper chambers that feed the ventricular chambers with blood. In my personal case, I had atrial fibrillation continuously for 10 weeks, nonstop, in 2005. The atrial section was fluttering at 260 beats per minute, which did not allow enough time for blood flow to refill the ventricular chambers completely. I personally can feel ventricular irregularities, however, I never feel the atrial arrhythmia. Now, doctors listening to this may say, well, that's impossible. You would have a blood clot within hours or days. At the time, I was taking so much magnesium, which interferes with blood clotting, that it was unlikely that it could form a blood clot. As also, certain blood types are less prone to blood clotting and have a very low rate of heart disease. And that would be type O, which is the blood type I have. Arrhythmias are potentially serious life-threatening heart events. Your general practice doctor will use an electrocardiogram machine, an EKG, to check out your heartbeat rhythm. When I went to my doctor in 2005, he immediately wrote out orders to send me to the emergency room as soon as he saw that constant arrhythmia. And later in the month, when I returned to his office to pay a small bill from that visit, the receptionist blurted out, "Hi, Mr. Wilkerson. We did not expect you to make it." Typical medications prescribed to control arrhythmias include beta blockers and blood thinners. These can prevent the strokes or heart attacks caused by blood clots when blood flow through the heart is stagnant. If the drugs do not work, emergency room doctors may try an electroshock, which is called a cardioversion. And then another option may be a defibrillator that's implanted or a pacemaker. It can include treatment such as radiofrequency ablation to burn away heart nerves causing AFib. My case was so serious because of genetic defect in my heart nerves that most of my heart nerves controlling the heart had to be burned away through ablation. This is a radiofrequency probe that applies heat. And my doctor implanted a CRT-D, which means a cardio resynchronization therapy device. This controls my heartbeat continuously 24 hours a day. There are multiple electrodes to every node in every chamber so that all the timing and delay signals are sent from this device. Even temporary arrhythmias can create stress for the heart, so it's important to eliminate them in your life. This information explains the seriousness of carefully choosing supplements and enzymes that manage to prevent heart arrhythmias. There are many causes for arrhythmias. Some are because of worsening nerve or heart muscle conditions. There can be nerve communications issues, deficiencies in magnesium, potassium, which provide communication through the heart nerves, as well as a lack of salt and sodium in your bloodstream. Too little sodium prevents the electrolytes needed for proper heart function. And then there are food allergies. In my case, I'm allergic to any product made with lemon juice. I start suffering mild heart palpitations with just a trace amount of lemon juice in regular mayonnaise. It took me years to discover this, but I knew there was a food trigger because it only happened under certain times of the day. One day in the middle of the afternoon, I pulled an Italian lemon ice. That's basically water, sugar, and lemon juice out of the refrigerator and started to eat it. There had been no other foods for hours, and suddenly I had serious heart palpitations, extreme, and I knew from then on lemon juice was my number one nemesis. Another trigger of arrhythmia in my family is synthetic vitamin E. Vitamin E is actually today a chemical called methylated phenol. Natural vitamin E can help the heart quite a lot, but finding it in its carefully extracted form is very rare. A friend of mine who had heart disease had an innovative doctor at Yale University Hospital, and he prescribed not synthetic, but pure natural vitamin E. And he used to have to order it through the mail because it was just so rare that no store anywhere carried it. The vitamin E has become a problem for me because it can trigger arrhythmias, and now, due to the large factories producing it, they've started to market it for use in regular prepared foods like salad dressings, pizzas, tomato sauces, frozen foods. Even fish oil capsules have vitamin E added as an antioxidant. Food scientists, that is those who make up foods with all kinds of formulas of chemicals, have started to use it in so many different kinds of foods that it's popping up without any warning. It's a minor ingredient far down on the list, and the next problem is that the FDA allows manufacturers to list it under different names. That way they can conceal what it is. Sometimes it'll be called a tocopherol, when in fact it isn't a tocopherol at all. It's a methylated phenol, which is a chemical that simulates vitamin E. 2 years ago, I had a serious episode of heart palpitation hit me suddenly without warning. My diet had not changed. We searched and searched for 2 weeks and finally found vitamin E on the label of a salad dressing that I had used for years. It had recently been added. So you have to watch out even on foods and condiments that you've used for years. The formula may change. The only safe salad dressing for me is vinegar and oil. Avocado oil with balsamic vinegar is truly luxurious. Once I remember eating some tuna fish sandwiches and feeling heart palpitations. No lemon juice was listed on the mayonnaise label. So I called the headquarters office of the mayonnaise company. I was directed to the president's assistant. She contacted the recipe office. They assured her there was no lemon juice in the formula. I had grown up working in the food industry. My father had taught me that many production lines would have dozens of labels coming down that same line. So I asked her to call the factory and find out if they also produced another mayonnaise with lemon juice. I was almost certain that it was coming from the mayonnaise. So she eagerly did so, and while talking to the quality control manager at the factory, he commented, "Sure, we'll use lemon juice in that mayonnaise." So she changed the formula, and I changed my brands in mayonnaise. Other heart palpitations or arrhythmias can include wheat gluten, allergies to medications, to xylitol, birth control hormone pills, certain peanut butters, foods containing mycotoxins like corn, Brazil nuts, coffee, foods containing triamine like aged cheese, smoked fish, cured meats, sauerkraut, soy sauce, miso soup, yeast extracts, and beer. Antidepressant drugs can inhibit MAO and cause some persons to have trouble with triamines, especially those with high blood pressure, hypertension, and heart palpitations. MSG is another yeast extract that is received a lot of bad press, so the FDA now allows manufacturers to use a long list of hidden names, alternate names, like autolyzed yeast extract or hydrolyzed yeast extract or hydrolyzed anything. More foods to watch out for are caffeine-based energy drinks, sodas, chocolates, coffee. It's even chocolates can vary. I find European chocolates from Germany and Belgium are safe for me, but nothing made in the United States because many of the lower quality chocolates use a Dutch alkali cocoa process for chemical conversion. If you experience heart palpitations each month, create a log on a notepad of everything you ate in the previous 24 hours. And do this every time it happens, and then start crossing over each log of foods until you find a common food or a common condiment, maybe a ketchup or maybe a barbecue sauce. Once you find a common cause, every time you have palpitations, eliminate it from your diet because you no longer can tolerate it. Heart arrhythmias are serious. You don't need to take powerful medications like beta blockers just to overcome certain types of foods that you are allergic to. Many long-term sufferers with heart arrhythmias have reported elimination of these episodes with vigorous exercise. Often there is no specific identifiable cause other than a buildup of stress in your body. I notice that if I have not gone on a bicycle ride for several days due to a business trip, I might have some palpitations at the beginning of the ride. Within 10 minutes, the stress hormones have burned off from exercise. We do live in a stressful world, and we may have to do things. I remember my uncle who passed away last year. His solution to cardiac tachycardias was to go out and chop wood until it stopped. He never told his family what was happening because he was too frightened. Eliminating arrhythmias should be the goal of everybody, even without heart failure in your diagnosis, because it can lead to it. We need to manage our stress, our food, allergies, medications, whatever it takes to eliminate arrhythmias. This is quite important. This is J. Randall Wilkerson, author of The Heart Failure Recovery Plan, Successful Heart Regeneration Using Metabolic Enzymes. This book is available from Amazon in print and Kindle editions. It's available from the Apple iTunes Store in an iBooks edition, and it's on eBay in the print edition. You can also order direct from the publisher, Wilkerson & Hughes, P.O. Box 777, Altoona, Florida 32702. Just enclose a check for $24 to include the book plus handling. Thank you very much.